No. Okay, audience. Cool. My informative speech is over the coronavirus. This virus has really spread quickly and it's very contagious. Some people are taking it seriously and some people aren't. And so I just want to inform you and educate you on all the symptoms of it, how you can prevent it, and then how many people have gotten this virus and have died from it. So going to the symptoms, they can range. It just varies, I guess, what strain you get. And so some can go from a common cold and then straight to death, which is scary. But the World Health Organization, so according to them, they say that the symptoms can be respiratory issues, a fever, cough, shortness of breath, breathing difficulties, and that's just your common cold symptoms. But then for your more severe cases, it can lead to pneumonia, severe acute respiratory syndrome, and then kidney failure, which then leads to death. And so these symptoms, I mean, it is scary if as soon as you get it, you go straight to the kidney failure. But if you get lucky and you have the common cold symptoms, it's very easily treated. You just have to make sure you stay on top of it. That way, like I said, it's contagious. You just make sure you aren't spreading the virus to other people. And so ways to prevent it, you have to obviously pay attention to yourself and to others around you. According to the World Health Organization, the masks that were sent out for everybody, they actually don't work. They don't help unless you get this expensive kind, but the expensive kind has ran out, and so I'm not really sure how they want people to prevent it with the mask. They just gave ways to make sure you're being more precautious, and so they, according to the World Health Organization, they want you to wash your hands, cover your mouth and nose for when you cough or sneeze, and that's just in general. I mean, hopefully nobody's coughing on each other. And then they want you to fully cook your meat and eggs, and I didn't realize this one, so I guess it can be carried through animals now, and it's not just human-to-human contact. And then they want you to avoid close contact with somebody who's showing respiratory symptoms. And so I guess that's where it really gets severe and serious, whenever it's not just like a common cold, it goes to your respiratory issues. And so they say that you can get the expensive mask, but that it's just important to take care of yourself and to pay attention to others around you. And so that leads to the traveling. I know being in a big crowd of people, it can be, you can't pay attention to everybody, and so they just say to lay low with big crowds and then to really try not to travel outside of the country where it is spreading very, very quickly. Luckily in the US, it's kind of only been spread here just because people from outside of the country have come back here. And so that's where the coronavirus has kind of spread throughout the US and come to Jacksonville itself. And so that leads to the third point, where who has it and then who's died from it. So Asia, Europe, Africa, America, and South Africa, almost all the continents have a case of the coronavirus. It's more serious in the Asia and Europe areas, but it is spreading here in the US. And so they just said, the world meter updated on March 6th, which is Friday, they said that 101,714 cases were, put into the CDC and the World Health Organization that everybody's aware of, and that's globally. And so out of 7 billion people, that doesn't seem like a lot, but this is something from maybe January or February, and for it to spread that quickly, it's just very contagious. And so they're saying to just lay low and travel. But then out of that 101,714 cases, 3,461 people have died from it, and that some are middle-aged people, but majority are children and adults, like elderly. And so I guess 3,000 out of 101,000 is not terrible, but it's still not good. And so it's just really important to take these precautions. And then for the people who have had it, the 101,000, at least over 50,000 cases have been treated, and they're healed now, and they're able to, lay low. They don't want them in big crowds yet, just because we're not sure how this virus works, but 50,000 people have been treated for it, and so they're better now. But the other 50,000, I guess they're still working on them and seeing all the different types of cases that can come through the coronavirus. And so the coronavirus definitely spread quickly, more quickly than anybody thought. It first started in China with just a few cases, and then all of a sudden it was in Italy, it was in Africa, and then it's here in the US now. And like I said, there are 2 cases that have just been put into the CDC for Jacksonville, and so it's scary when it comes to your town. But it's really important that you're paying attention to your symptoms. Even if you think, oh, I'm just got the cold, like, you never know who you've been in contact with because it's so easily spread. And then it's important to prevent it. Cover your mouth and do everything correctly to make sure you're staying clean, and then the others around you are staying clean. And the media is constantly posting about this. Every day I get an update on my phone, and so it's just important to stay updated on where it's at now and if it's near your town or if it's near your city. Thank you.